Hey everybody, Dr. Schultz with the Centeno-Schultz Clinic with another weekly update. Thank you for checking in. Today we're going to be talking about shoulder tendonitis. The goals of this short presentation are to describe what in the world is a tendon, what is tendonitis, what is shoulder tendonitis, what are the major symptoms, the causes, and when should you call a doctor, and if you ignore it, what are the complications of shoulder tendonitis. So let's get started. A tendon is basically a thick piece of connective tissue that connects the muscle to the bone. A muscle can't connect to bone, so it needs this thick connective tissue, which is known as a tendon. And tendonitis is simply an inflammation of that tissue. And this is a microscopic image of what happens at a cellular level. So a shoulder tendonitis is basically an inflammation of the shoulder tendons. And the major ones that you need to know are the rotator cuff and the biceps tendon, you know, the Popeye. So the rotator cuff is 4 major tendons in the shoulder, which are depicted here. They're the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. The supraspinatus is the most commonly one involved. And what are the major symptoms? You got it. It's pain, but it's also inability to keep your hand or arm up, particularly overhead. And many patients also complain of pain at night. They wake up and it's just aching, deep, searing pain. What are the causes of shoulder tendonitis? Well, they're not limited to just NFL or other athletes. It can be a repetitive use injury for those people that spend time in a gym or on the field playing recreational or intramural athletics. You can also have some impingement, which is a mechanical narrowing of a space, or shoulder instability for those patients that have loose ligaments, like patients with EDS or hypermobility. And those patients that have just kind of poor overall mechanics are susceptible to shoulder tendonitis. When should you be calling the doctor? If you have persistent pain or restriction in range of motion that does not respond to conservative care, that's the time to be calling your doctor. Why? Because shoulder tendonitis, severe cases, if not addressed and treated, can go on to leading to tears in the tendon. That's right, rotator cuff tendon tears, which are a significant finding and require treatment. You can also morph into chronic pain. You can have erosion of your well-being. You can have reduced range of motion. And in some severe cases, you can actually get a frozen shoulder, otherwise known as shoulder capsulitis. So if you or a loved one are struggling with shoulder tendonitis characterized by pain and restriction in range of motion that has not responded to conservative therapy, consider a consultation at the Centeno-Schultz Clinic, where you will see a board-certified fellowship-trained physician. We offer both in-office as well as virtual evaluations, and often the treatment is PRP or bone marrow concentrate. And what's unique is at the Centeno-Schultz Clinic, we are able to customize the PRP and the bone marrow concentration to deliver your needs. In addition, all injections are performed under X-ray or ultrasound guidance. And we look beyond the shoulder. That's to say, we'll look at the cervical spine if indicated, because that also may be causing or driving some of the shoulder pathology. Thank you so much for checking in, and I hope you enjoyed learning about shoulder tendonitis. Till next week.